When jowls start to form, they have a profound impact in reshaping the appearance of your lower face, and having jowls is a prominent sign of aging. Jowls decrease the definition to our jawlines, and considering that a well-sculpted jawline is desirable for all genders and ancestries, you can understand how jowls can be aesthetically displeasing and bothersome. Actress Liv Tyler says she's getting jowls just like her rock star dad, and Rachel Hunter, a 46-year-old former Sports Illustrated swimsuit cover model, took to wearing scarves to hide her jowls and considered plastic surgery. Almost everyone will get jowls by the age of 50, without intervention, that is.
So can you really help tighten the skin with Sculptra? Does it help with jowls to improve your jawline contour? Yes, it can. I'm going to show you how you can use Sculptra to prevent and treat the formation of jowls. But you should know there are a lot of other factors that play into why people get jowls and why some people get more noticeable jowls than others. We'll discuss those too, and I'm going to share some advice on preventing jowls from forming that has nothing to do with cosmetic treatments. And I'll share some real patient examples of how Sculptra helped treat jowls and improve their jawline contour. And we're starting right now.
So what exactly are jowls? Jowls are excessive skin or subcutaneous fat that droops or sags around the jawline. In a youthful jawline, the skin is taut and smooth, but as we age, jowls reshape our jawlines, eventually leading to the loss of jawline definition and the squaring of the lower face, diverting us away from our triangle of youth that we've spoken about in other videos. One of the first signs that you may start to notice when jowls start to form is a separation or depression to the skin tissue and a subtle draping of the skin just lateral to the area of the depression. You can see compared to when she was younger, Alicia didn't have this depression, and the surrounding tissue had more volume and it was more harmonious.
When people first start to notice jowls forming, they commonly come in saying, I want to do this, because they're starting to feel heavier to their jawlines, or they say, this is bothering me.
Who is at higher risk for forming jowls? Jowls will eventually affect everyone to some degree, but the age at which they become noticeable and the extent of their impact vary significantly. There are certain jawline shapes and a specific facial aging type that cause someone's jowls to be more apparent, which leads to more heaviness around the jawline and a more squaring away of the jawline. If you fall into the facial aging category of sagger or descender, which means you have thicker, heavier skin, you're more likely to form jowls. This is why your facial aging type plays such a big role, and if you want to learn more about facial aging types, watch this video after. If you're a sagger with a round or square facial shape, you're more likely to form jowls. This is especially true if you're a sagger with a brachycephalic facial shape. A brachycephalic facial shape means that your face is wider and shorter. This facial shape, coupled with thick, dense skin, makes you more likely to form jowls. Kate Bosworth has a brachycephalic facial shape, but she doesn't have thick, dense skin, so she's less likely to form jowls. You may have heard the term Asian jowls.
Some of my patients of East Asian ancestry, they've actually used this term. They say, I'm starting to get Asian jowls. And this is because some people of East Asian ancestry, some but not all, have very dense skin with more facial fat compared to other ancestries.
So their thick skin combined with a wider, more horizontal jawline makes the skin around the jawline more likely to descend, as opposed to those with a more narrow V-shaped jawline. You can see the difference between Christy Turlington and Helena Christensen. They have different lower face vectors. Who do you think will be more likely to form jowls, Helena or Christy? Well, let's look at how they've matured. Christy's a sinker with a very narrow V-shaped jawline, and sinkers get jowls too, but it's not as apparent as those with wider jawlines and thicker skin. People who are overweight are also more likely to form jowls because the skin tissue thickens as we gain weight, making it heavier and more likely to descend. Alec Baldwin had a narrow jawline, but weight gain has made him heavier and wider to his lower face. Why do we get jowls?
There are a lot of factors that come into play with why we get jowls.
As we age, we get loss of elasticity to the skin, our fat pads deplete, and we get bone loss. Jowls will appear more prominent in relation to the areas with more bone loss, and this corresponds to that separation we spoke about earlier, which is actually a depression called a pre-jowl sulcus. This pre-jowl sulcus is due to a combination of bone loss and loss of elasticity of the skin, and it becomes more noticeable in women around menopause. You can see it's a little more subtle in Mina Suvari, but compared to when she was younger, this area was more full because all of those things were more abundant: bone, fat pads, and collagen. With age, the skin in your cheeks and below your jawline loses its collagen and elastin, and collagen is our skin's primary connective tissue protein that helps maintain the skin's cohesion, and it's essential in preventing sagging and drooping skin. As years pass, our collagen is not only breaking down, but it's changing from the stronger type 1 collagen to the weaker type 3 collagen. Elastin is another connective tissue protein that lets your skin return to its normal shape after being stretched. Together, collagen and elastin form a 3D network to provide the skin's strength and elasticity. As both of these proteins are lost, the skin weakens, causing it to sag and descend below your jawline. So how can Sculptra help with jowls? And can Sculptra really help tighten the skin?
Sculptra is regenerative. It's a biostimulator, so it stimulates your skin to produce collagen.
Mainly type 1 collagen, the stronger collagen, and it's also been shown to significantly improve skin elasticity, and in a recent FDA study, it was shown to tighten the skin and improve jawline contour. So what areas do you target to help with jowls? In order to address jowls, you have to take a 3-dimensional global approach to restore lost volume. Let's use Pamela Anderson as an example. Target areas for her should be this whole entire region of the cheek, especially this very back area of the cheek, because this is what gives this area support. When we lose volume here, it can result in loss of support to the skin overlying the jowl area, resulting in draping of the skin.
This is why if someone's older and let's say they do masseter Botox and the muscle atrophies a lot, it can actually accentuate jowls because this whole area here helps give this area support. So this back area of the cheek right here, this is never an area that people come in saying needs to be restored. People don't notice a volume loss to this area because
people have the habit of looking at themselves in the mirror from the frontal view, so they don't really appreciate how their faces have aged from a 3-dimensional view.
I feel Sculptra has a big advantage over filler in volumizing this area back here because being that filler is a thick hyaluronic acid gel, it doesn't spread well here. I do like to use filler to the mid areas of the cheek and sometimes along the zygomatic bone area here, but not as much to the lateral area because it doesn't do a good job spreading here because that's a large area to add volume to.
In this patient, we did 2 vials of Sculptra, and you can see that her jowls improved. They look smoother and more lifted, and that's because we treated the areas of volume loss here and here, which helped give the skin overlying the jawline support. This gentleman was first treated with 2 vials of Sculptra, and you can see that his jowls improved, and we did that by restoring volume here and here. And these are his results after his 3rd vial of Sculptra, and you can see a gradual lifting of his jowls and improved jawline contour. His jawline looks more defined now. No other treatment was done here. No radiofrequency devices like Morpheus, no fillers, so this was all from Sculptra.
Now, is everyone going to get these results? Absolutely not. Your facial aging type plays a huge role in general. The thicker and denser your skin, the more difficult it's going to be to improve sagging. The 2 patients shown didn't have extremely dense skin. Also, let's say you're older and you haven't done anything and you're at the point where your skin has lost a lot of elasticity. You would be more of a candidate for a surgical facelift. This is why it's so important to start early when you start to notice the subtle changes in your jawline, because chances are if you're starting to notice jowls, it's because you've likely lost volume to your midface. So you don't want to get to the point where you lose too much elasticity.
2 important factors in preventing the formation of jowls is
your body weight. We already discussed that your body weight plays a very specific role. So let's say you fall into the facial aging category of sagger. It's even more important to maintain a healthy weight if you're worried about jowls because your skin is already heavy. So gaining weight would likely make your jowls worse, making it more difficult to treat with injectables. Watch this video if you want to learn more about how facial fat impacts getting injectables. Having good dental hygiene is another important factor. Loss of a tooth tooth or teeth significantly accelerates bone loss. Take care of your teeth and try to do everything you can to hold on to them. If you do have to remove a tooth or teeth, consider getting implants. In the first year after losing a tooth, 25% of the surrounding bone can be lost, and it will continue to wear away over time. So replace missing teeth as soon as you lose them and practice good everyday oral hygiene habits. And you can do this by staying up to date with your routine dental cleanings and exams and avoiding too much foods high in sugar. If you want to learn more about Sculptra and how you can look more naturally beautiful, be sure to check these other videos out.